The equipment that you will need from stores includes the Cleanse Choice Kit, the Ekin Ring, and the Solution Cassette. In addition, you will also need the vac machine, the vac canister, which is the same that is used with regular vac therapy, sterile gloves, a normal saline bag, a 250 to 500 cc bag, normal saline irrigation bottle or cup, sterile gauze, and sterile scissors. Adaptic is not used with vac Veraflo. Open the Cleanse Choice Kit and use this as your sterile field. Add in any extra supplies needed and apply your sterile gloves. This particular wound has already been cleansed using proper aseptic technique and has been dried thoroughly. Wipe the peri-wound skin with the Kevlar barrier wipes that are supplied in the package. After allowing this area to completely dry, apply the Ekin moldable ring to the peri-wound edge. Do not stretch or overcompress the ring to prevent leaking of the installation fluid.
A tip is to keep the plastic component in the package to help stick down the ring without sticking to your gloves.
You may also use more than one ring to accommodate for the size of the wound. Cut the Cleanse Choice foam with holes in it to fit the wound bed. Once you've done this, choose either the thin or thick solid piece of foam and use your piece of foam that you've already cut as a stencil. You can also use both pieces of foam if you need to, depending on the size of the wound. Ensure that the depth of the wound is filled. It can either be level with the wound or slightly above. Apply the foam into the wound bed. Again, the piece with the holes goes directly on the wound with the solid piece of foam on top. Do not allow the foam to touch any intact skin. It may touch some of the Ekin ring, but ensure that it does not overlap. Next, secure the foam with drape as usual. Do not use excessive amounts of drape, as this can prevent evaporation and lead to maceration of the wound. Also be sure never to wrap an entire circumference of a limb. Once the wound is draped, use your scissors to cut a hole in the center. It must be the size of at least a quarter. You can try pinching up the drape to help cut the hole in the middle of the foam. Once you've cut your hole, apply the track pad, ensuring that it lays directly over the hole and that the direction of the tubing is suitable for the patient. Next, connect the tubing lines accordingly. When the screen turns on, choose the VAC Veraflo option on the main screen. Settings will be provided by the wound care team or ordering healthcare provider, including solution amount, installation dwell time, and suction amount, intensity, and time. Veraflo will always require intermittent or DPC suction. Begin with the suction phase and not the installation. Once the seal is maintained, begin the installation phase to ensure proper filling.
Press around the edges of the foam to try and block any leaks. And if this does not work, use extra drape to try and cover the areas that are leaking.
Once the dressing's in place, ensuring that there are no leaks, monitor the vac canister and solution bag carefully to ensure they are changed promptly when required. If problems occur and you cannot troubleshoot, switch to regular vac therapy and notify the wound care team or ordering healthcare provider. If regular vac therapy cannot be used, discontinue the negative pressure wound therapy and switch to a moist, sterile dressing until the wound can be reassessed.